So we're going to try and wrap up a little bit. We've gone across the cancer journey a little bit. If there was one sort of pain point along this pathway that you could intervene on short term, what do you think would make the biggest impact to the quality of cancer care we're able to give right now? So for each of you, your perspective on what's one change you would like to make tomorrow that would improve a cancer patient's experience in a general way? Obviously, there's variation between patients.
Yeah. Well, yeah, I mean, I'll start. There are many things to choose from, but I think that point we highlighted earlier of us being completely separated from the money and the financial kind of aspect of it is really critical, and I wish was quite different, right? And that we actually had the option of giving patients treatment without necessarily worrying about the financial toxicity of it. And maybe in Canada you guys have gotten a bit closer to that, but it's of course there's a flip side of this as well, of course. But yeah, it's just I know this is something that's really, really difficult for many patients, and I think really affects the care we give them, the care that we're able to give them, and it's a problem right now that's really largely outside of medicine, and that we can't really adequately address without really probably more major social and political changes, really.
I think that's also my number one. And then there's a stark contrast, right? We're here at ASCO and we're seeing these incredible advances, and we're seeing combination therapies of really promising and crazy expensive drugs. And this conversation isn't one I had multiple times today, And so that's a problem. I think that's a problem with sort of how we are approaching advances in oncology in this country. A small thing that I'm just thinking of that I would fix that I think could be achievable on a smaller scale, because we've got big ones to do for that, would be, imagine when you're leaving a doctor's appointment, actually me or you, I'm leaving a doctor's appointment and I don't really have a say in the time of my follow-up. I'm leaving and they're gonna call me and they're gonna say your visit is at 3 and your infusion is at 4, right? And I'm like, but I might have had to work that day, or I might have had to pick up my kid that day. So obviously that's not gonna work for me. We need to fix that, right? But we do that to our patients all day long because that's the infusion slot that's available, and that's when we have availability on our overbooked schedules. And so I think sometimes we are doing our best as a human in that interaction to acknowledge their full selves outside of being a patient receiving cancer care. But the system has a way of just sort of acting like this must be your full-time job and not accommodating that full self and all the other people that they are outside of being a patient. So I think that system in terms of sort of scheduling would be a change we could make.
It seems like it's a way to give patients back a little bit of autonomy in a circumstance that's really probably making a lot of people feel quite powerless. Yeah. And this is just a small piece of maybe control.
Yeah, Mondays and Wednesdays are my clinic, so thus you're going to get treatment on Mondays and Wednesdays, right? I mean, just things like that. And there's logistical challenge, those are the days I'm in clinic. I'm not in clinic all week, but things like that. Yeah, I totally agree.
So that's what's one thing you'd like to do if you could make us all do it better.
On a lighter note, I'd like a magic wand and a Star Trek device. I've told patients that multiple times, I think just, being mindful of the person sitting in front of you is a person. And I've caught myself doing this, but making sure that I'm saying the prostate cancer, not your cancer or this cancer, making it seem like it's part of them. And then just communication throughout the whole team. I think a lot of good points were raised here. I could get started on the financial thing. I work with it every day. I have to calm people down and things like that. But I really wish some of these things could be fixed. It shouldn't be a matter of I can't afford this treatment, so I can't get it. In this, especially here, you're seeing all these breakthroughs and everything. I think it's important that all treatment options should be available to all patients who are potential candidates for them, for the treatments.
Absolutely. Well, I would echo all of these amazing sentiments and actually bring up something that you mentioned that I had forgotten about that slide, but it's a very important slide to me, the X factors. So we all kind of touched on them, and we all have been talking about some of the things that come into play, whether it's people's responsibilities, whether it's the time constraints, whether it's their own sense of self and who they are. They're a professional, they're a parent, they're a sister, they're a, whoever they are. For all of us in medicine to think about those, and I think that's kind of what we're getting at, to elevate those aspects of the humanity of our patients as we're taking care of the cancer and the person and trying our best to get that best sort of combination of cancer control and life out of it at the end of the day. So these kinds of conversations are so great and also wonderful to have, not just with the docs on the team, but with the other team members, because we're all in this together, patients and providers of all kinds. And so I appreciate being here.
Absolutely. So thank you so much for joining. I think this has been, I had high hopes for it, and I think it was better than I had hoped for. So thank you all for your time. I really appreciate it. And I hope that for those of you listening, it's been as interesting and informative for you as it is for me. And thank you again for joining us.